turn this table around real quick because it's a better angle. So let's do this. Can you help me with this? Let's put the head down here, and I'll take the tail this way. And then let's move it up this way.
Glad I'm getting all this.
There we go. Okay, and then let's move the head that way a little bit more. A little more. There you go, that'll work. Okay, perfect. So I want you to lie down on your stomach, and I would like you to just like your head at the head of the table, and I'd like your right hip here and your left leg off the table. Okay. Now, let me you just stay there. I'm going to slide this thing. Go up. This position is a position we're going to use quite a bit. A little bit later, when we talk about sensibility. Now, take your left leg, put your foot flat on the floor up here a little bit. And I'm going to keep raising it up here. I know you're taller. Got it. Okay, now bring this foot in just a little bit. There you go. You feel like you're still elevating off the table a little bit?
Yeah, a little bit.
How many feel like the table's kind of flat? Right about there?
Yeah.
Okay, good. All right, so her hip flexion, slide down towards me just a little bit more. There you go, good. The reason I wanted her, the bend of her hip in the table is because I'm going to use this later to move her into hip extension possibly, okay? I'm not going to do it now, but I can possibly do this later. The next thing that we're going to do is we're going to take something like this, and it depends on the patient's extensibility and how much mobility they have in their hip. There we go. Good. All right. Your hips feel like they're level on the table?
Yeah.
Okay, good. Okay. So, one other thing we may consider doing, if we have to, towel or anything around? Small towel. Okay, good. You guys can't see this because we don't have two cameras, but I'm going to place this towel underneath her ASIS on this side because she's got a little space here. And then when she rolls over on it, it'll hold her ASIS real stable. So if you look at this picture in your book, you probably can't see all this. Can you? You can't. So you got this person that their head is up here, so that'd be to your right. Okay, you're looking at the picture. Then you just see the right leg, and you're like, where the heck's the left leg? Well, that's what it looks like on the other side of the table, or down on the table on the other side. Okay, make sense? You with me so far? Okay, then you're going to notice that he's going to cradle this leg. He's going to come across here like this. He's going to cradle this leg in a little bit of flexion. He takes this left leg, sticks it right behind here. It actually might be a little mean. You might have her put it up a little bit more. There you go. Keep your leg in, though. Don't abduct it. Want it real tight. Okay, you all right? He holds this like this, and then you come in here, and again, the table, now she's taller. So for me, I can do a couple things. I can try to use my hand like this, but it's not as efficient because I can't get over her. So what I'm going to do instead is use my forearm and come in here, right underneath the gluteal cleft, and then I'm going to lean into it like this. You feel a little bit of a stretch there? It is a good stretch. Okay? Anterior glide. Increasing hip what? Extension. Great mobilization. What I can do to make this a little bit more intense is I can flex the knee. What's that going to bring the intensity level up on? What's that going to tighten up a little bit? Rec fem, right? Or, see how this table works? I don't even know. Okay, hold on. Hang tight. Let me see if there's a little lever. Oh, here it is. Okay, you got that for a sec? I'm just going to do this. Yep, how you like that, man? Just like that. Good. More in the hip extension, and then I'll bear down through the hip. Okay? Feel a little bit more? Got it? Great mobilization. This idea, all right, come on up off of there. No, wait a minute. Go easy here. Okay, now come on. This mobilization, now when you walk, you're going to feel like, whoa, you have a lot of hip extension. That mobilization, or that idea of that ventral glide with any type of rec-fem or ellipsoid stretching is something we're going to do later, and it's very similar to when you do the rotational stretches of the shoulder. Adding that glide into it, it adds an extra component to it. It really intensifies it. It's a great thing to do. Okay? And what do you think a lot of patients lack, especially your patients with OA and things of that sort? Hip extension, right? That's one of the parts of the capsular pattern they're going to have a problem with. Now, some of you are probably thinking, how in the heck are you going to get my 73-year-old mother in that position? You're not. And it's illegal to do that in 3 states. Okay? So, but you're going to have to make some modifications. So, grandma might just be laying on her stomach, right? And then you're just working through one hip. Getting grandma on her stomach might be a goal in and of itself, okay? And then just doing a light glide, all right? So can I use just grandma for a second? Sure. Come on, let's go over. So laying down, Granny. Okay. So I can just say, okay, slide towards me, Nana. Okay, lift your hip up. There you go, good. Now, I'm not going across the body any longer, okay? And then I can take this, and I can put this underneath the ASIS. And again, you're going to have to make adjustments as necessary. You got everything going on underneath there? You got the furniture rearranged? Good. Right. That is good. Right there. All right, so then I can take this. Since I don't have to deal with this other leg, I can take the table way down, okay? And that's actually nice because you don't have to use your forearm now. And you can do a couple of things. You can do it, Nana might not be able to tolerate this knee being extension, so you could put this a little bit in flexion here, like this, for 2 reasons. Maybe she doesn't like knee extension, because it is hyperextended. So you can put something there like that takes your knee out of extension, but what does it do to the rec fem? Tightens a little bit, and then you can roll this, what? Up for Nana, okay? Good. Then I can come in here from the top, find his gluteal cleft right here, and then take your hand like this, and then you can come straight down on top of that. Okay? Now, one of the things that actually works pretty good on this, too, is, let's do this, without getting too much undone. Let's go everything completely to your right, slide to your right. Everything go. Just keep going. Way over. Take this way over. Okay? All right, good. I could come from this side, too, and come across. Now, here's something that I do like this part of this, is when they lack extension, they lack what also? Internal rotation, okay? So I can take Nana's hip, and I can pre-position it into a little internal rotation, okay? Just a slight amount. Then when I come across her body, I can take this hand, and I start in with my heel of my hand towards the midline, and then when I perform this move, I actually roll her. See, I pre-positioned her, and then I roll her. I come straight over top, and then I do the dorsal glide. I like that. That helps a couple of different things, okay? And you can get your body right over it. This is probably my preferred way of doing it, is going across the body, but I just wanted to let you know if you want to stay on the same side, you could. It's not in the book, but it's adding in that rotation, okay? Keeps your fingers out of the midline, too, okay? But that's the main reason. All right? So I want you, yes?
Oh, sorry. I just have a question on the other one. You know, in clinicals, whenever we did that, they had their one leg hanging off the side. Hamstring, like, I guess pain was really, really big. Like,
Yeah.
How do you prevent that?
Well, it's a very common thing, especially in a tight person. So the way to combat it first is stretch their hamstrings first. If you do that, that's one thing. Make sure you're on their hamstrings. They still might have some tension there. You can take them to this position. If it's not, the best position for them, you can just take their foot and bring it back like this. Instead of having heel flat on the floor like that, that's maximum. You can allow them to let their foot come back a little bit like this.
Okay.
Or in some cases, even like that.
Okay.
But it's not for everybody. Oops, sorry. But in a, like, I'll give you an example, like, we treat a lot of triathletes, and those guys are tight as all get out, okay?
Mhm.
But they don't feel much of a stretch like this. So you gotta get a little bit more aggressive with them. So we put them over the side table, bring their hip up, then if they're smoking their left hamstring, you say, all right, let's bring that down to your not smoked. Okay, good. Let's work there, and then we start moving that thing up.
Okay.
So you're gonna have to make adjustments on the fly.
Okay.
That make sense?
Mhm. Yeah.
Questions? It's a good technique. So I want you to try it with